Biohacking Gut Health, Part 6, our last one for this series. And thank you for sticking with me all these weeks. I appreciate that. I appreciate comments. I appreciate your referrals. And let's talk about biohacking. What do we mean by biohacking, really? Biohacking means you're using technology and science to make your body function better and more efficiently. In case of gut health, it is to make your gut function better and more efficiently. Digestive health is the largest key to immune system health and overall health. That's why I'm very passionate about healing the gut in order for you to have that energy, in order for you to have a great immune system, not get sick when everyone is sick around you. That all depends on gut health. So today's topic of our biohacking gut health is the role of food sensitivity testing. I know that many don't feel the same way. I know that food sensitivity testing has we will say bad reputation, or we have people that don't trust it exactly. And I also seen some things related to food sensitivity testing that made me skeptical over the years, because I've been doing functional medicine for over 15 years. But overall, root cause analysis is often still asking for it, and you have to understand which type of food sensitivity testing, because there are different ways to do that. And if you happen to have a particular food sensitivity that you are unaware of, one or two, and it's pretty severe, and you remove that particular food for a short while, you will decrease that chance of inflammation. So you could be a skeptic, but it does work. And that's why we want to talk about that today. What is food sensitivity testing? It's the test that measures immune response to specific foods by analyzing changes in white blood cells. It differs. It differs from food allergy testing, which identifies life-threatening IgE-mediated reaction. So not the same. Food sensitivity testing focuses on IgG-mediated or delayed immune system response that may cause chronic or low-grade inflammation. So yes, you don't immediately get sick. You don't immediately react. Sometimes you do, but a lot of times you don't. But it builds up, it causes that low-grade inflammation, and you have no idea that it's happening in your body while now something comes along, right? You could be around a virus, and if you have that low-grade inflammation, your immune system might not react adequately and that might not protect you the same way. So constantly getting sick because of that low grade inflammation. That's why I believe this has a really important place, this type of testing, still as a root cause testing. Why it matters. Food sensitivities are linked to inflammatory reactions. Inflammatory reactions are again, they involve cytokines. They contribute to systemic inflammation over time. Chronic exposure to those foods that trigger sensitivities may exacerbate gut health issues like leaky gut, which again opens up a whole bunch of problems in the system, and overall health conditions. Who should get it? Anyone with suspected food allergies or sensitivities. I say anyone with gut issues to begin with, because if that hasn't been tested for you and there's only one or two foods that need to be removed for a little while to decrease the level of inflammation, why not take that improvement, right? Individuals seeking to identify underlying causes of inflammation or digestive discomfort, they should consider doing this test. Patients with symptoms like bloating, fatigue, skin conditions that may relate to diet, should consider taking that test. Key insights from food sensitivity testing. Number one, identify trigger foods. We used to have that uh, theoretical testing when you just remove the foods and reintroduce the foods and blindly trying out this scenario. It's complicated. I think it's so much easier to see the results of the test and being able to manage it after. But you could consider that as an elimination diet, what they call it. I believe in testing because I've seen it work faster, more efficiently. If you want to get to feel better, this is a faster way. So, number one, identifying trigger foods, pinpointing specific foods or food chemicals that body reacts to. Number two, leaky gut clues. A long list of intolerant foods may indicate intestinal permeability or leaky gut. That's again, if you see a lot on that food sensitivity testing, it's almost an automatic indication of leaky gut. Number three, inflammation management. Tests measure changes. They measure changes in immune cells, lymphocytes, monocytes, neutrophils, eosinophils to gauge that inflammatory response to foods. Approaches to testing. IgG based testing measures antibodies indicating food familiarity, but doesn't always reflect active inflammation. So it may lead to unnecessary food restrictions, reducing dietary diversity, and harming food gut microbiome. That's why we have that room for a practitioner to hold you by the hand and don't just present the results. There has to be common sense and there has to be someone that understands the entire process. That's why testing is important. Working with someone that understands this process is very important. We have cell-based testing. It uses fresh cells to access the total inflammatory response, providing more actionable insights into food sensitivities. Again, you need someone that understands the difference and can lead you by the hand through this process. So, question, of course, nothing is perfect, right? And here it's another scenario where it's not. Question with IgG testing. While IgG-based tests are popular, they can be misleading, prompting patients to avoid many foods that they didn't need to without symptom improvement. A restrictive diet, especially, negatively impacts gut health because that will decrease the diversity of the microbiome and limiting the diversity of nutrients needed for balanced microbiome. What are the alternative options? The elimination diet that I mentioned, it's an elimination diet. It still remains cost effective because you didn't spend the money on testing, and a relatively accurate method to see food sensitivities. By removing and reintroducing food systemically, patients can identify those triggers without the risks of over restrictions. But that's we are guessing a lot here. What is the takeaway? Food sensitivity testing can provide valuable insights into your diet, role of inflammation, and gut health, but it should be used cautiously and you should work with someone that is really experienced in the process. Combine testing with dietary diversity strategies and professional guidance to achieve the best outcomes for your gut, for your overall health, for your immune system health, and for your quick improvement. Follow for more tips and on testing, on gut health, on inflammation management. Subscribe, like, and share the information with your friends, with your loved ones. This is Dr. Ina at Digestive Reset. Comment below if you have questions, if you've experienced improvement or did not experience improvement after doing this type of testing. Again, I'll see you next time. This is Dr. Ina at Digestive Reset and Melamed Institute. Take care.